Thank you. This is John Hoban again with the Society for Participatory Medicine. Here with Dr. Mike Mascia. Mike, you go by Dr. Mike, right?
Right. Thanks.
All right. Yeah. Well, as you heard in the short version of our interview, Dr. Mike's all about cooperation, participation, people helping people on a global level. And that's ultimately what the society is supposed to be all about from a participatory medicine perspective. And Mike, tell me a little bit about your background. I know you're an M.D., M.P.H. Where did you attend medical school? And tell me a little bit about your history.
Yeah, I graduated from Tulane Medical School in 1972, and then I went and did a family medicine residency. I got a combined M.D., M.P.H. degree, so that meant that I was able to get both degrees by the time I finished medical school. So we were the first group actually that was able to do that. We were the icebreakers. There were 4 of us in the class who actually started that program. So that was a Tulane program from 1972. I went and did the family medicine residency at the University of Miami. And then I came to Maine in 1975 to do family medicine, which I did for 14 years. A part of that was in 1979 or so, between 1975 and 79, it was obvious that there were a lot of folks who were coming in that really didn't need disease care. They just needed some guidance about how to take care of themselves, better care of themselves. And so that's when we started working on the stress management workbook. So that was the term stress management workbook was used, and the title is the stress management workbook, an action plan for taking control of your life and health, which is the more important part of it. It's an action plan, and that was done because people really didn't know how to do that. So we're trying to help the folks in the practice. That was why it was written. Anyway, so that went on, and we worked with a small percentage of the patients who were motivated enough to go ahead and take charge of that. And then most of it, what we were doing was disease care, traditional care and treatment. I took care of patients in the hospital, a lot of surgery work, emergency room, pretty much full spectrum care. And then I went back and did further training in 1989. I went back and did a anesthesia residency in critical care.
That was up here at Syracuse, upstate, right?
No, I went to University of Maryland and the shock trauma unit there to get the training. And when I finished that, I went to SUNY in Syracuse.
Ah, okay.
To do that, and actually that was working as the director of critical care anesthesia. So I took on there the anesthesia critical care component for the department when I went there. And so I worked there for several years. We set up the program. All the focus at that time during most of my career has been on care of the sick. It's you don't get paid for keeping people healthy, John.
Yep.
It's an interesting problem, but what the thing we call healthcare is really disease care. So, and that's the only thing we get paid for. So,
right.
So while I continued my other activities, trying to help folks, preventive care and all the full spectrum of care, but the day job was running critical care, anesthesiology, and mostly taking care of disasters. So that's been my focus for a long time. It's an undeniable issue because we see the casualties from inside the system and the ones that come from the outside.
Exactly. So you've seen it from both sides of the fence, especially going from primary care to then into critical care and within a subspecialty with anesthesiology. You've seen the train wrecks and you've seen the trains before they became the train wrecks.
Right. And you see them from inside the systems and from outside. Some, and it's interesting to look at the causes of these problems. Uh, Many of them are preventable, and this is the striking thing.
Yep.
Many of these problems, especially the disasters, are preventable if they're addressed earlier.
Yep. The ounce of prevention, pound of cure, right?
Yeah, and it's pretty obvious when you're in the middle of it. It's obvious what the opportunities were
Yeah.
along the way to do a better job.
Yeah.
So, and a lot of that is the system. What we call system problems really means we're not looking at the problems to try to solve them. So,
Yeah, especially in a fee-for-service environment, as you said, there's no financial incentive to do the preventive portion unless, and I don't know, what's your thoughts on provider organizations becoming the payer and going at full financial risk?
you know what? I think there are all kinds of proposed solutions, um, but they seem to be patches. They're patches to a system that doesn't work very well. So I'm not convinced. I'm not convinced that that's the way to go. I don't have any problem with trying new things, but I think the problem we have is that we're stuck on a system that focuses on disease care. So we can change the focus, but you have to start paying people to keep people healthy. You have to start paying to keep people well and to prevent the diseases. Now, obviously, some things are going to happen anyway. I mean, there are some things that just happen by chance, bad luck, genetics in the wrong place at the right time, and you know, okay, so we do what we have to do to take care of that. But if you really want to focus on prevention, you have to have a system that pays people to get them healthy and to keep them healthy. So.
Yeah. So how do you see the society participation, both from your individual perspective as well as from the other members? What's the best mechanism for the society to help achieve some of those goals of getting to root cause analysis and true health?
Well, I've learned over the last few years that the biggest mistake I've made is to do my work for patients, and we really need to work with patients because what's happened over the last 10 to 15 years is that physicians have no power. So we cannot change the system from the inside. But if we work together with patients, the patients have the power. I mean, a single patient who is informed can go to a hospital administration or a newspaper or social media, and they can have a tremendous impact. Now, if I go as a physician, they think, oh, well, he's just a disgruntled guy. But, uh, my message hasn't changed in 40 years. This is a clear and simple problem from my point of view. But we, those of us who are on the inside who care, really have no power.
Yeah.
And so working with patients, uh, there is power. There is no power without it. So when we set up Veritas Health Care with the idea that it's a level playing field. Everybody who comes there is an equal player, and it's a safe place to develop solutions. And I see Society of Participatory Medicine as an organization that really wants to do the same kind of thing. I see the need for us organizations to cooperate as well, and I don't see much of that happening. And
Yeah.
and I think those are opportunities to increase the power base.
Tell me a little bit about more of Veritas. I know I've seen the base camp set up, and that is not that's different than the for-profit consumer health-oriented Veritas company, correct?
Correct. We are a nonprofit which grew out of a for-profit. Actually, we were designing a for-profit in New Orleans when I was working at Tulane with a group of people. So yes, I went from SUNY to Tulane. So in 2000, and basically did the same, took on the same job there. But there were several of us who were beginning to realize the limitations of our impact.
Yeah.
So because of that, because we saw the quality issues as very important, we started working on alternative structures outside of the system. So we designed a for-profit. That was blown away by Katrina, but we stayed together virtually over the years after Katrina. And in 2013, we set up the nonprofit Veritas Health Care. Now, our idea was initially to set up a cooperative to provide health and healthcare services, which would be the intention was a patient-physician co-op.
Okay.
So we took that first step to set up the nonprofit in 2013. We're building the community of people who are like-minded. That's what Veritas Healthcare is doing now, and our next step will be to actually promote on-the-ground and virtual cooperatives to provide care.
So right now that the cooperative virtual has been just kind of a voluntary formation initiative, but then there will be an on-the-ground initiative, both where you're based in Sweden, Maine, which I don't think is too far from Portland, right?
Correct. And the idea is to use virtual, global, cooperative model and telemedicine as a stepping stone to building hands-on care. The idea also is that you can train local people to do a lot of the hands-on stuff and to work with the local physicians and other providers. So that would be the concept, but we're now just doing it in a very limited basis as a kind of a health and healthcare literacy kind of thing.
Okay, yeah, and it sounds like it dovetails right in with the IHA, the triple aim, and also you had mentioned something about Katrina. I want to, for a future time, we're about out of time today, but I do want to dig into the excellent presentation you shared on preparation and what you saw, where it was or where it was lacking, and firsthand from Hurricane Katrina at Tulane. But before we sign off, what are some of your parting thoughts as we move forward some of these initiatives in the society?
Okay, well, you and I have briefly talked about use of social media to facilitate diagnosis, and I think we had a one-word conversation. But I think that this is I'm not a social media guru, but it's obvious to me that we can de-identify patient information, send it out to an appropriate social media network, and get opinions about diagnosis and treatment to short circuit the delays in health and healthcare.
Yeah, I know there's at least 6 or 7 initiatives at Health 2.0 and others that are hopefully, or they're hoping to be on an IPO track, but that's another topic as well. Dr. Mike Mascia from Sweden, Maine. If people want to reach you, I think you gave us an email address in the shorter version. What's that address once again?
Okay, I'm going to give you the Gmail address. It's M.F. Mascia, M-A-S-C-I-A, at gmail.com.
Excellent. Dr. Mike, always a pleasure. This is John Hoban signing off with Dr. Mike Mascia for the Society for Participatory Medicine.